Now let's talk a little bit about my philosophy at Hansten Healthcare and Relationship and Results-Oriented Healthcare Program. What is our philosophy of nurses as healers? I believe that healthcare is a series of unique, private moments in which we make contact with the person who is requesting our care. And these moments of healing are the building blocks of health. Within that space, that instance of connectedness and presence and authenticity with another individual, that's where the healing magic occurs. The quality of those moments of connectedness, those, I believe, are the safe and sacred spaces of healing. And those relationships that we have with our patients and families are the core of our practice. We certainly have need of establishing excellence in our relationships with each other as colleagues as well, and with our other interdisciplinary team members. There are three major elements to relationship and results-oriented healthcare. Many of you, this is a review. So we'll just go over it in enough detail so people remember what those elements are and what the 10 steps are and what that will achieve in terms of outcomes. So, what are the interventions? Again, what are the outcomes? We must know our patients. We must be able to have those times of healing so we understand what results they're looking for, what their short and long-term goals are, what their priorities are. And then, once we know that, we can do critical thinking and problem solving to get to those preferred outcomes. And we must work with our other team members to help those patients get to those outcomes or results and priorities. And we use a bundle of 10 best practices to get there. So what we have in front of us is the example of the three elements, and then this graphic shows the 10 steps in a graphic form. So there are 10 steps here. And so let's say we start with 7 a.m. on a nursing unit. We make our assignments based on the patient and family's 4 Ps. So the purpose, picture, plan, and part. Purpose, picture, plan, and part. And that means we must know them well enough to know them individually and what results they're looking for short and long term. We also then, in any of our handoffs, whether it's between shifts or between areas of practice or areas of the continuity of care, whether it's from a department to a department, ICU back to med-surg, that our shift reports and handoffs have to be able to incorporate the 4 Ps for that patient so that nothing gets lost, so nothing falls through the cracks, because we know this is one of our places that we have patient safety issues. We're going to then plan with the team and give initial direction about how the shift will go, so that we make sure that if we're working with assistant personnel that we include checkpoints and timelines for them and a debriefing time toward the end of the episode of care. What we've done in the RROHC program is we've incorporated the steps of delegation and supervision so that nurses have a template or a shared mental model to use in order to be effective leaders at the point of care. So we're planning with the team what that shift is going to look like and how we're going to communicate with each other. And then we're going to be doing some kind of introductory rounds. You can combine these if you actually do shift handover at the bedside in an acute care setting. But we're going to set up how we're going to be doing rounding and how we're going to be reconnecting with our patients as well as with each other. We're then making sure that the RN is able to do that focused interview, that healing moment time at the bedside, at eye level, talking about what results the patient and family or family want to achieve, short and long term, and that plan then is communicated to everybody else on the team, assistant personnel, people at the point of care, and has to be also communicated with the interdisciplinary team members. So interdisciplinary rounds are up there as well. We have our checkpoints with our assistant personnel incorporated before and after breaks and throughout the shift, and we must set up then at the end of the shift that time for the debriefing. Certainly what happens after an airline flight, we can do it too. 3 to 5 minutes. What should we have done differently if we'd had the same assignment? What would you suggest I do differently? This is my suggestion. What could we tell the next shift that's important for them to know? And then that information is then sent on to the next episode of care. Whether you're working in an ICU setting or a home health or public health setting, these same concepts apply. And we have specific tools that will help with that. So if we're going to look at the results that the relationship and results-oriented healthcare program is able to achieve, we see that these are all things that cannot be achieved without these other steps happening at the point of care. We cannot have staff engagement if people don't know what results they're trying to achieve with the patients, and that they are a part of those results and they know they make an impact. We cannot have patient satisfaction if they're treated like a slab of meat on the bed. It's only if there's a real individual connection and the patients know that they are cared for. Safety. If you don't know your patient, things happen that aren't the right thing for that patient. Quality outcomes. What results looking for? Avoiding pressure ulcers, other nurse-sensitive indicators, falls with injury. All those things are made possible because we are able to do these things at the point of care. Team satisfaction and joy. Oh, it is so wonderful to see a team that is excited about the results that they've helped patients and families achieve, and that they celebrate those before they leave each day. And the teamwork across the continuum works so much better when people understand the 4 Ps for the patient and family. So that's relationship and results-oriented healthcare in a nutshell. So a progression from Florence Nightingale with her thousands of patients and several nurses, and now really looking at that individual patient and family, the healing moments that we have with them, and helping us to figure out how to work together effectively with a template or structure for care called RROHC. You know, caring is a choice, and we can choose to care or not to care. And certainly our patients and families know. Karen Miller uses this definition of caring. Caring is an intentional action that conveys physical and emotional security and genuine connectedness with another person or group of people. Caring validates the humanness of both the caregiver and the cared for. So when you really choose to care, when you choose to be authentically there, present, connected, listening to the patient's story, when you choose that, you're really being refilled. Your tank is getting refilled because you know that you're making a difference. Florence Nightingale said this as well. She said, all hurry or bustle is peculiarly painful to the sick. You can certainly remember that when you've been sick. Nurses must possess themselves entirely, working in a steady, calm, organized manner in the sick room. That sense of presence, that emotional intelligence, the critical thinking that's necessary for you to be able to really manage yourself in such a way that you can be totally there while you're there. To really understand, listen, be there. Don't be thinking about all the other things you got to achieve or do that day or that 10 minutes. Because if you are, you really can't pay close attention to what's happening with that particular patient. So the relationship touchstones that I offer you to reflect on. That you first must make the decision to care. You have to be able to learn how to center yourself and let go of those other things that are bothering you. That you're able to learn how to listen with a focus on that individual patient and or family member, but listening with compassion and caring. That communication then that you use helps guide them, asking the questions that are necessary to help them think about what is most important to them right now as an individual. What is it they need now or within the next 10 minutes or 15 minutes or 8 hours or 12 hours. And then making sure that you can listen to their story, because that story, listening to that story is a part of the healing process. Florence Nightingale said something else that I'd like to share, because we're all struggling with trying to create a better healthcare delivery system right now. She said, "No system can endure that does not march. Are we walking to the future or to the past? Are we progressing or are we stereotyping? Remember that we have scarcely crossed the threshold of uncivilized civilization in nursing. There is much to do. Don't let us stereotype mediocrity. We are still on the threshold of nursing. I believe we are still on the threshold of nursing today. In the future, she says, which I shall not see, for I am very old, may a better way be opened. May the methods by which every infant, every human being will have the best chance of health, the methods by which every sick person will have the best chance of recovery, be learned and practiced. Yes, I think we can all join with Florence in wanting that to happen and being a part of the solutions that are necessary for that complex healthcare delivery system change. So I'm going to ask you to join me, wherever you are, in the Nightingale Pledge. It's probably been a while since you've thought about it. I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous, and will not take or knowingly administer any harmful drug. I will do all in my power to elevate the standard of my profession, and will hold in confidence all personal matters committed to my keeping, and all family affairs coming to my knowledge in the practice of my calling. With loyalty will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. Thank you so much for joining us in our celebration of Nurse Week 2011. We'd like you to join us in the RROHC program, in the RROHC education that we have available, and follow us on Twitter, at Facebook and LinkedIn, and at our blog at hansten.com/blog and RROHC.com, RROHC, for Relationship and Results Oriented Healthcare. Thank you so much for joining us.